Welcome back. So in this video, we're going to be looking at stretches for the spine area, the ribs, the neck. The neck and the shoulder are kind of like intertwined. We're going to be doing a separate video with the shoulder and arms. So some of these muscles do operate the shoulder, but we're looking primarily at the spinal region for these ones. Now, spine area, notoriously difficult to stretch, right? So we're always as dancers, I can't get in that spot, I can't get in that spot. So some of those more active release techniques can be useful when we're in this area. And we'll also look at some different varieties using a table versus on the floor, and try and help you to wind these up and sweeten them up so that they hit the right spot for you. Okay. General common or garden stretch, done class, you've done a lot of arabesque, your back muscles are feeling tight and sore. A good way to just relieve them. This doesn't really stretch for dancers, but it's really just kind of offloading and just reversing the curve of the spine. And it's your basic child's pose. So if you guys want to take up that pose, so you're kneeling down, you want to try and maintain the hips down on the back of the heels. And as you're there, just making sure you're really relaxed, not allowing the shoulders to hunch up as you do it. Make sure the shoulders are relaxed. So even just hanging out there and offloading will be helping just the spinal muscles to release, even if you're not feeling a stretch in the traditional sense. If we want to sweeten this up a little bit more and bring it more into the rib area as well, we can't really isolate anything in this area. We're stretching lots of things. But what you can do is walk those fingertips around to the side, and then you're opening up and fanning one side of the back. So you're creating a little more space on one side of the spine and then also opening up the rib cage. And what you can do in that position is, if you do both take a really deep breath, you're expanding and stretching the ribs as you're in that position, and then let it out. So you can actually use your lungs as kind of airbags to stretch that rib cage from the inside. And then walk your fingers back and then around to the other side and just balance things up. Always when you're doing stretches on both sides, check in and go, was one side tighter than the other? And then ask that question. And in all these videos, I'll always be saying, yeah, but why? Yeah, but why? If you find differences, try and figure out what it is you're doing. It might be something in the choreography you're doing. You can come back to center now, guys, and roll yourselves back up. It might be a particular asymmetry in your body. Some people don't like that one. Yeah, come off the knees there because it's on the knees. So you can choose to do that or not. You might just want to lie yourself over a fit ball or something as well, is another way to get into that position. Okay, now another muscle that's really causes most of the trouble in the lower back. So in the lower back region, it's a muscle called the quadratus lumborum. You don't have to remember that, but you might want to. We call it for short the QL, to shorten it down. And it's responsible for a lot of the pain of lower back pain. If you've got any instability in our spines, we have you on a turn side view, Chloe, and just arch your back for us. We have a lovely hypermobile dancer here. If the lumbar spine is quite unstable and you've got maybe some unstable segments in there, the QL muscle often goes into a contraction or spasm to try and protect that. So again, if you're getting really tight in the QL muscle, you want to ask why. Okay, if you just turn your back again all the way around, and I'll just draw a picture of where the muscle is. So it's starting from your bottom rib, so your 12th rib at the bottom there, and it runs diagonally across down to the top of the pelvis here. So you've got two of them, and they're going in a little V shape out that way down to the hip. And it's the muscle that, you can turn yourself around again, the muscle that bends us to the side, and it also does a bit of rotation. Now, to sweeten up a stretch for this, we have to be very careful about the particular vectors we put into this stretch to make sure we really hit the spot. You can do this sitting, but you can actually get more kind of power into it if you're in a standing position. So we're going to we'll turn you to the side, Jean, that's great. And we're going to have our legs just a little wider than hip, just nice and comfortable. And we're going to do a plie there just to really drop the center of gravity down and stabilize the stretch. Now, any of you contemporary dancers out there, we're going to do a really nice Martha Graham contraction. So we're going to tuck under so that we really scoop out. Just relax for a moment. Because the muscle runs from the last rib down to the hip, any stretch that you're doing, you're trying to move the attachment points away from each other. So by doing that contraction and tucking under, we're actually moving the hip bone away from the rib and therefore creating the stretch. If you do this stretch with your hips tilted the other way, which is the mistake a lot of people make, you're not actually going to hit the stretch. So that tuck is a really important vector. Now, we're going to do a side bend, but we're going to go halfway between front and side. So we're going to the corner. So you're going to bring one arm up over the head, hold on to your wrist, and you're going to pull yourself over, keeping that tuck going as you do it. Just for a moment there, Jean, if you just release that tuck and stretch out, are you feeling a stretch? Nope, it's gone. As soon as you tuck under, we sweeten it up in there. Keep those shoulders relaxed in that position so that we're not tensing something else while we're stretching this muscle. What you can also do if you're not feeling it is just add a little rotation in. Just try and sweeten it up, play around. Keep the hips still and kind of move that rib cage on top. And for different people, you'll hit it in different spots. So you can kind of play around and sweeten it up. You can come out of that now. I don't want to leave you there for ages. If you want to reverse that and do that the other way, maybe turn your back and then you can do it the other way. That's it, and just balance yourselves up. So this is a stretch for the QL muscle. It will also involve the ribs also. Some people will feel it more into the rib cage than into the QL. You're never stretching one thing in isolation. But that can be a good one to help really unravel that lower back tension. Okay. There's another stretch we can do if you're not feeling that one in a standing position. We can also adapt that if you've got either a treatment table or something that mimics it. We can switch up and do one on the table. And we'll show you that right now. Right, so now we're going to look at a modification for the QL stretch. This is very similar to the gluteus medius stretch we looked at in the hip videos. This is only something you can do if you've got a sturdy treatment table at your disposal. Don't try this on anything that's like just a regular little trellis table or something because it'll tip over. We're going to be on the edge of the table, so you want something that's stable. A lot of people try to do this on their beds, but really the beds often aren't high enough, and also beds are a little bit squishy, so you kind of really don't get the stretch in the right spots. So only do this if you've got a stable surface to work with, and ideally there's somebody else there with you who can hold on to whatever you're doing this on so it doesn't tip over. Okay, so this again is, we're talking about it in the context of QL, but what it's really doing is getting this whole lateral chain. So some people will feel this in the side of the hip, some people in the ribs, and some people in the QL itself. It's going to tell you where you're tightest. So we can use these stretches as kind of diagnostics as well as therapeutics. Okay, so for this one, you can see she's perched right on the edge of the table here because we're going to need the leg to be hanging down. And then what we're going to do is have you lie down sort of in a diagonal here. We're going to bend up this underneath knee because we're stretching the top half of the body here. And we're going to have this leg, you've got to make sure that your hips are stacked over each other and your shoulders are stacked over each other. We're not tilted forwards or backwards. So we're using gravity here, the weight of this leg hanging down, to open up this whole area. And again, in this position, you could take a deep breath and use those lungs to inflate and stretch the ribs from the inside as you're in that position. But this is a good one for opening up this lower back area. Okay, and then if you bring yourself back up to sitting from there, and of course you can repeat that on the other side as well. Okay, so that's QL. Now we're going to come up and do our stretches for the shoulder and neck area. So I'm going to bring Chloe back in. If I have you come, Jean, to this side of the table, we're going to do a standing version and a sitting version. They're the same stretches, but they will give you different options. Now, with the trapezius muscle, which is like the big muscle that goes from the base of our skull here all the way down, and it's like, I call it like a shawl or a cape because it sits over the top of the shoulders here, but it's also obviously a neck muscle because it's going up. There are no muscles that are just affecting one area. So to stretch this one, we're going to tilt the ear towards the shoulder, and if your neck is good, if you don't have any injuries to the neck, you're going to use your hand. So you're going to use the same hand as the side of that your neck is tilted towards, and you can just use that to apply a little pressure going over. Remember, as I said, no pain, tingling. If there's any of those sorts of things, back off. Now, because we're stretching the muscle from all the way up into the base of the skull here, down to the shoulder, what you can also do is walk your fingers down your leg, or if you're sitting, hold on to the seat so that you're anchoring the shoulder down one way as you're stretching the head the other way. Be mindful that you haven't got this shoulder cranked up around your ear, otherwise you're stretching one side and scrunching the other. And again, hold it there for your 30 seconds. I would say 30 seconds maximum for this one because we don't want to put too much pressure through the neck. Don't go hell for leather on this one. Just a little bit of pressure is enough. You don't have to force that neck into any positions it doesn't want to go in. They're delicate structures. Okay, so we're now going to refine that just a little bit, and we're going to target the levator scapular muscle. Now this one runs in a similar direction, but it's a smaller, thinner muscle, and it's actually attaching to the top of the shoulder blade here and running up into the back of the neck this way. If you've ever put your finger around this area, you probably find it's quite crunchy, right? There's that really crunchy spot, particularly for those of us who like to hang over our phones and our laptops, that it can get very loaded there. So this is a stretch for that one. So we're starting with the head center, and rather than tilting it for this one, we're going to turn it just a quarter turn, so halfway between front and side. Then again, using the same arm as the direction that your head is turned towards, and this time, rather than pull the neck sideways, you're going to pull the chin forward to the chest. And similarly, we're going to walk the fingers of the other hand down or hold on to the chair surface that you're sitting on, and feel that more diagonal stretch going through this area. Okay, great, and come back up. And then if we want to get the muscles that run all the way down either side of the spine up into the neck there, we can bring the hands behind the head, clasping the fingers there, bring the elbows together, and again being mindful that we're not scrunching the shoulder muscles as we're doing that, and then pull your chin down towards your chest. Now, some people will feel this quite low down in the back. Some people might find it up into the neck area. So it's, it'll find your stiffest spot, let's put it that way. Okay, and come back up. All right, now you can turn around and have a perch on there. Remember, as we were talking about in the first video about the length of these stretches, for those static stretches, we're really looking at a sort of 30 to 60 second window. So for your QL stretches, then that would be a good window. For the neck stretches, I would say 30 seconds max, because we really don't want to hang out in those stretches too long. What's a good thing to do for our neck muscles, particularly if your neck's feeling a bit spasmy or a bit cranky and you don't want to put it into that position, a nice thing we can do is if you use your opposite hand and just come across, and you're going to come right down as far as you can reach there, pick up all that tissue and roll it forwards. Actually, if you stand up, and you can show back view of that so you can see what you're doing. That's it, really get in there and then roll all the way up, and you'll find you go over that little levator scapular tendon there and up into the traps. And what you can do with the front of the hand here, what we call the heel of the hand, is actually press that into the front bit of that trapezius muscle just above your collarbone, and then pick the whole thing up and roll it forwards. As you do that, you can circle the shoulder back the other way. So we lift up, roll, shoulder goes back the other way. Lift up, roll, shoulder goes back the other way. How does that feel? Good. Feels nice and juicy. Yeah, so really good for those neck and shoulder, particularly if you're somebody who does weight bearing on the arms. So that's a good way to release the tissues up without putting them through a stretch. Then we also need to look at just a bog standard rib stretch, okay? We looked at the QL stretch. Really, if we just modify that without that tilt, so actually you can do it in a sitting position, you could do it in a standing position. So we're just going to, for this one, arms straight over the head, bend to the side, that's it. And again, you're opening up the ribs here, take a deep breath there and expand those ribs as you do it, and release and come back up. And then obviously you can repeat that the other way if I get out of your way to do it. Okay, so that's without the contracted position. A dead side stretch will target straight into the rib area. So remember, if you're wanting to improve your flexibility, you need to do your 30 to 60 second stretches on the particular muscle you're targeting. You want to repeat that 3 to 5 times in one setting. So say it was those ribs, you could do your 30 seconds this way, again, 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 and that's one set. And then you need to repeat that one set 3 to 5 times per week. That's if you want to improve the flexibility of that muscle. If you're just looking to release today's tension so you don't carry it into tomorrow, you can just do 2 or 3 repetitions of those 30 to 60 second stretches, but you don't need to do the repetitions of it. You're just taking out today's tension so you don't carry it into tomorrow. But don't neglect the spine and back area. Even if you're not feeling that it's a really deep stretch for you, the muscles are still being relieved in that position and they will thank you for it.